What recommendations do you have for myeloma patients that do not want to try a whole food plant-based diet?
I don't think everybody needs to switch to a complete 100% change, because I know that can be hard for a lot of people. I think incremental small changes are where the difference lies. So most of the data shows like up to, if you can move towards an 80% plant forward diet, and the 20% can be whatever else you're craving and things like that, you are going to get most of the benefit out of it. The last 20% is important if you really want to go the full way, but that last 20% is not as important as the first 80% of moving towards it. And so you can start small with a few things, like maybe in having a fruit every day, and then thinking about your plate as to what you're eating. So most people's plates have the meat as the main and the veggies as the side, but maybe switching that to having the vegetables as the main and then the meat as the side. So changing the percentage of these foods on your plate. The Canadian food plate is a nice plate to look at, and you will see where a quarter of the plate is whole grains, half the plate is fruits and vegetables, and a quarter of the plate is protein foods, out of which most of them are beans and legumes and lentils, and a small part of it is meat. And the drink of choice is water in that food plate. And I think it's a nice food plate to go by. Another way you could do it is, instead of having about 80% of each meal, you pick most meals being fully plant-based, and then you have some meals that are completely not, because that's what you would want to do. But I'm thinking about it overall as, in a week, how many meals of mine or what percentage of my meals are there. And wherever you are, just starting by changing and increasing like a 5 to 10%, I think is important. And then gradually, as you see the benefit, that might drive you to change it further.
I personally don't have a specific pathway that I transition people in my myeloma practice. I think that's a very individualized conversation. It also does require knowledge base, right? Knowing what to do and suggestions. It's one thing to say, go have a plant-based diet. What does that mean? Do I'm eating salad and broccoli all day? So it's important to provide resources, which we do in our clinic. Giving people tips and ideas to help really get them going, so that they can do these things. But also sustaining behaviors is also very hard. For our clinic, we have a behavioral psychologist who helps with wellness plans. How can people find change within their lives that's doable and sustainable? These are the important questions.
Is there a specific nutritionist patients should see? Is there an oncology nutritionist?
There are. So we have oncology, people who just see our cancer patients here, but that is kind of a luxury of a big city, and so a nutrition is a great place to start. Insurance usually will cover at least one visit. It depends on what condition you have. So each patient here gets one visit as part of their care, but insurance coverage varies depending on the diagnosis, but that is a great place to start. And there are a lot of online resources too, that American Heart Society, they show you what a healthy plate looks like. So there are it does require, typically having some kind of internet access. American Cancer Society has all this information on their webpage. I think patients are looking for this. It is there, and there are usually visual pictures and other guidances that you can find pretty accessibly. I think the hard part is getting on a program and sticking with it, and sometimes it's knowing what you should do. And I think the one thing I would say to patients is, it's not all or nothing. Change is incremental. No one's perfect, and no one doesn't splurge or exercises every day or does everything right all the time. And the goal is not to be 100% perfect. The goal is to integrate things, and 2/3 of plants and vegetables is a lot on a plate. Even going from 0 to 1 or 2 per day is a step in the right direction. And so, I just encourage people to try new things, try new activities, try new foods, and don't think you have to be perfect.